Throughout the pandemic, infectious disease experts have been thrust into the public eye, becoming, in many cases, household names. CBC's Ian Hanomansing has written a book about some of those doctors, and it's called Pandemic Spotlight: Canadian Doctors at the Front of the COVID-19 Fight. Ian's also a familiar face and voice to us as the host of the National and other programs, and he joins us now. Thanks for being here.
Well, thanks for having me.
Why did you want to write this book, and why now?
I had interviewed these infectious disease doctors so many times, but I still didn't know who they were. And I was really curious about their path to becoming infectious disease doctors. And also the fact that they kept answering our calls over and over and over again. The other thing is the path they took from anonymity to becoming household names really intrigued me as well. So I thought, yeah, let me give them a call and get some answers.
How did you find time?
I got up early a whole bunch of days, a couple of hours, and I did most of the writing in May. So the days were getting longer and it was quiet in the house, and I would just do my writing before work. So actually it worked out pretty well.
You say it's unusual in Canada for medical professionals like these to speak publicly in the way they have been. How so?
Well, and not even just medical professionals. I would say experts generally. As you know, I've been a journalist for a long time, and I've spent a lot of time trying to convince experts when a story is really in the forefront of the news to speak with us. And you often hear people say, they don't want to do that. They don't want to affect the story. Maybe their colleagues kind of look at them skeptically when they appear on television. And so to have these 9 doctors who just were willing to kind of shrug that off and say, I have a public duty to talk about this pandemic and help people understand it, and to keep doing it, it really was impressive to me.
Many of these doctors are basically famous now, but not everyone is a fan or kind to them. What did you learn about the toll this has taken on them?
I spoke to them for at least a couple of hours on the phone, maybe a little bit longer. And this is something they didn't talk about until I started asking them about it. And they actually said they were getting a lot of feedback, a lot of good feedback, a lot of people who were thanking them for what they did. But you know what it's like with social media and with people being able to figure out what personal emails are. You just figure out if you're at a university or a hospital, how to reach the person. And they got some real criticism, and criticism isn't what they minded. It was the personal stuff. And even then, like I learned, these infectious disease doctors had incredibly thick skins, and even the occasional time that some of them had to call the police because a threat crossed the line, even then, they never seemed deterred at all from continuing to speak publicly.
In the book, you go back to your very first interview with Dr. Bogosh before the virus even had an official name. The pandemic's kind of felt a bit like a time warp. What stands out when you look back at those early interviews, aside from the number of times that we said the word presumptive?
So it was just how, right from the beginning, I realized that this was a different group, that Dr. Bogosh, Dr. Hoda, the first 2 interviews I did, Dr. Saxinger, and on, that there was something special about them. But Dr. Bogosh said in that very first interview, I think it was January 20th of 2020, at the very end of it, and he had to tell me how to pronounce his name, by the way. I had never met him before, hadn't talked to him at all. But he said to me, call anytime. I don't think he had any idea how often we would do that.
It takes a lot of work to write a book, but you are not making money off this one. Why not?
These doctors, have donated all of this time, and not once did they ask us, obviously, for money. And we don't give money to people who appear on the news, but they didn't even ask for a toque or a mug or anything like that. So I thought, given the theme of this book is about the service that these doctors provided, I should probably not make any money from this book. So all the royalties are going to UBC Medical School for a fund for a student who's interested in public health or infectious diseases as a specialty.
Well, thanks so much for this, Ian, and congratulations on getting it published.
Yeah, thank you for reaching out.